Here's one of the big problems I see in the Lyme community, or chronic Lyme or post-Lyme disease treatment syndrome, and it's what I call the lesser of two evils trap. And the underlying cause is essentially that you're having a problem and you go to a medical establishment that has an underlying germ theory kind of reference frame. And so they view the germ as a bad thing, and so they feel they need to kill the germ, and they're going to use a poisonous substance like something toxic to kill the germ. The problem is that thing is toxic, and it's toxic to you, not only to the germ, bacteria, whatever the scenario is. And that is when most people are seeking help, that's the first thing that they think of, or that's the first thing that they're offered. And commonly, that's the only thing that they're offered, with maybe possible variations of the same kind of thing, just moving to a different drug or then moving on to a steroid or something else like that, even if it's not all antibiotics. The problem is these things are inherently, they're poisonous. They're not good, so they cause problems in the body. And so if your only options are things that have a negative side effect, let's call that one of the evils, and then you're constantly doing that or compounding, doing multiple of those things at the same time, people end up getting many negative side effects and ongoing problems actually from the drugs and prescriptions that they use. And many people stay in that cycle for years, decades, or longer. So that's what I call the lesser of two evils trap. I think there's a time and a place for that approach. Certainly if somebody, say, has an infection in their leg and it's going to spread to their body, you cut the leg off, but it's not inherently a good thing to cut the leg off. And similar in warfare, you can drop a bomb on somebody. It's not a good thing to drop a bomb on somebody, but that may win the war. So there is that element, I believe, in acute Lyme, and people can argue about that. My point here is for those of you with ongoing symptoms, months, years after having Lyme, being treated for Lyme, that if you get stuck in that lesser of two evils trap, you can get lost in that for a long time. And I believe you need to start to move to more fundamental strategies that are actually going to supply the body something that's missing. You're going to actually eliminate things from the body that are poisonous and stop putting things into the body that are damaging it. So the next lesson, we're going to talk about plant-based medicine approach. So instead of using a toxic treatment type of approach, we're going to look at the concept that for every illness, there's a plant to heal it.